So the pituitary gland. What is the pituitary gland? So basically, we talked about the basics of endocrine system. So we have endocrine system to maintain or regulation of body. Okay. So regular endocrine systems have glands, and glands release hormones. Okay. So endocrine glands have glands. Endocrine glands releases chemical substance that is hormones. Okay. So first we have here the glands, the pituitary gland, hypothalamus, pineal gland, thyroid gland, adrenal gland, and pancreas, ovaries, and testes. So first we will talk about the pituitary gland, the master gland, because it have the all the elements to control the minimum glands. So basically the pituitary gland is the master gland and also control the other glands also. Okay, the pituitary gland or hypophysis. So it's mean the pituitary gland is also known as hypophysis. Heads by a short stalk infundibulum from the hypothalamus and is enclosed by the sella tertia of the sphenoid bone. Despite its small size, the pituitary gland regulates many body functions. Its two major portions are posterior pituitary gland, neurohypophysis, which is an extension of the nerve tissue of the hypothalamus, and the anterior pituitary gland, adenohypophysis, which is separate glandular tissue. All of these hormones of the pituitary gland and the target organs are shown. It may be helpful for you to look at this summary picture before you begin reading the following section. So this is the pituitary gland. So this pituitary gland divide two parts, anterior and posterior. So posterior have different work, anterior have different work. So we will talk in detail. So let's see the location of the pituitary gland. So this is the location. So basically here we have the sphenoid bone. This is the nasal cavity. Sphenoid cavity, here we have the sphenoid bone. From the sphenoid bone, you can reach to the sella tertia. This is the sella tertia. Okay. Sphenoid bone. This is the sphenoid bone. Okay. And along with this is attached the pituitary gland. Okay. Anterior pituitary gland and posterior pituitary gland. So let's see the different functions of pituitary gland. Okay. Pituitary gland will release growth hormone, ACTH, TSH, FSH, LH, prolactin, oxytocin, and ADH. So let's see the first posterior. So we'll talk about first posterior about what are the things posterior pituitary gland will do. The two hormones of the posterior pituitary gland are actually produced by the hypothalamus and simply stored in the posterior pituitary until needed. The release is stimulated by nerve impulse from the hypothalamus. So basically, the posterior pituitary gland is the gland which actually which releases the hormone which are produced by hypothalamus. So basically, this is the hypothalamus, this is the pituitary gland. So posterior pituitary. So it will release the hormones and stored in the posterior pituitary gland. Hypothalamus releases glands. It will release in the posterior pituitary gland whenever necessary. It will release. Okay, it will release by the nerve impulse. So whenever hypothalamus advise, please release my hormones, it will release. So what are those hormones? Let's talk about first hormone, antidiuretic hormone. So you can see that this is the hypothalamus. hypothalamic hypophyseal tract. This is the tract, and this is the pituitary gland. The whole pituitary gland. Okay, optic chiasm. This is the posterior pituitary gland. This is the lobe vein, inferior hypophyseal artery. Okay. Next, we will talk about antidiuretic hormone. Antidiuretic hormone, ADH, also known as vasopressin. So, what is the other name of ADH? The other name is vasopressin. Vasopressin increases the reabsorption of water by kidney tubules, which decreases the amount of urine formed. The water is reabsorbed into the blood, so as urinary output is decreased, blood volume is increased, which help maintain normal blood pressure. So what EDH is this? Antidiuretic hormone means it releases a hormone which reabsorb the water from the kidneys. Means whenever the blood is going to filter into the kidney will release all the water substances, all the waste material, okay, into the urinary bladder, and it will flush out. So, but what antidiuretic hormone it will see that whether kidney is not exceeding the water quantity from the out of the body, so it will absorb, it will see, okay, then it will, if it is doing like that, large amount of water is going throughout the body, so what will happen, what will you want to, you will always get thirsty, you need to drink water regularly. Okay, so basically what is we have to what is the ADH work? It will reabsorb water, whatever necessary things are present in the water or in the after filtration of the kidney processes happen, so it will absorb and see, it will reabsorb that. Okay, this is the thing. And IDH also decrease sweating, so large amount of water is stored into the blood, so your BP is maintained because blood volume is maintained by water only. Okay, the amount of water conserved is much less than the conserved by the kidneys. The stimulus of secretion of ADH is decreased water content of the body. If too much water is lost through sweating or diarrhea, for example, osmoreceptors is the hypothalamus detects the increased saltiness of the body fluids. The hypothalamus then transmits impulse to the posterior pituitary of the increase the secretion of ADH and decrease the loss of water in urine. The stimulus of secretion of ADH decrease water content of the body. So whenever ADH release in the body, what will happen? The amount of water is decreased in the body. So water is stored in the body. No large amount of water is released from the body. This is the main concept of ADH, antidiuretic hormone. So what will happen whenever we have diarrhea, okay, any vomitings? What will happen? We have receptor, that is osmoreceptors. Where is present? It is present in the hypothalamus. Okay, so it will hypothalamus will send the nerve impulse to the posterior pituitary gland. For what? Our body fluid is wasting, okay, from vomiting, from diarrhea, lots of water is waste, so you need to store the water in the body. So whenever this signal from the hypothalamus reach to the posterior pituitary gland, so what will happen? Posterior pituitary gland, the what will do? It will release ADH hormone. So AD what will do? It will reabsorb the water from the urine. So whatever large amount of water is not exceed from the urine. Okay. Any type of dehydration stimulates the secretion of ADH to conserve body water. In the case of severe hemorrhage, ADH released in large amounts and they also cause vasoconstriction, especially in the arteries, which will help to raise or will at least maintain blood pressure. The function gives ADH is other name vasopressin. So basically, whenever emergency condition is happened, whenever our body water lost, so you think there are multiple things. Whenever our body functions, our body release water in vomiting, in diarrhea, in bleeding, okay, and other things like there are a lot of things, sweating. Okay, so what will ADH, what will posterior pituitary gland do? It will release ADH into the body. The other name of ADH is vasopressin. Why? Because it will do vasoconstriction. It will constrict the blood vessels, so body blood pressure is maintained. So this is very, very important. Ingestion of alcohol inhibit the secretion of ADH and increase urine output. If alcohol intake is excessive and fluid is not replaced, a person will feel thirsty and dizzy the next morning. The thirst is due to the loss of body water and the dizziness is a result of the low blood pressure. So very good thing is here explained that that is if a person took large amount of alcohol. So whenever there is nowadays it is very common that everybody is taking alcohol due to the stress, due to their busy schedule, due to their sleepless nights. Okay, all the multiple things are there. Okay, so whenever they take, what will happen? ADH decrease. Why? Because alcohol stops the release of ADH. So ADH is decrease, input output decrease. Input output decrease. What will happen? The person will feel thirst and and dizziness, giddiness. Okay, so patient will feel dizziness and giddiness. Why this has happened? Because of water lost from the body. The ADH is not released in the body, and so the water is lost from the body. The blood pressure is decreased, and the water is lost. So that the reason the patient feels thirsty. If the replacement therapy is not done, so what will happen? These things happen. Okay, so that's the reason alcohol is very dangerous to our health. So it is not advisable to take in small amount, even though some scientists tell it is benefit to the health. But in my opinion, it is very, very harmful to the body because simple thing here explained that it will inhibit the ADH hormone, scientifically proven. Okay, it will stop the release of ADH hormone. What will happen? The patient will dizziness, the patient will thirst. Okay, so this is the very, very important thing we have to remember. And whenever a patient comes to you, you have to explain all those things. Okay, next is oxytocin. So pituitary gland release two hormones, anti-diabetic hormone and oxytocin. What will oxytocin do? Oxytocin very, very important during pregnancy. It will contract the uterus at the end of pregnancy. So whenever 9 months completed, so it will contract the uterus. So when the baby will come out, and also stimulates the release of milk from mammary glands. So its second function is to release milk from the mother breast. Okay, this is the second important function. So oxytocin do two things. One is contraction of the uterus, and second thing is releasing of milk from the mammary gland. The labor begins, the cervix of the uterus is stretched, which generates sensory impulse to the hypothalamus, which in turn stimulates the posterior pituitary oxytocin. Oxytocin then causes strong contraction of the smooth muscle myometrium of the uterus to bring about delivery of the baby and the placenta. The secretion of oxytocin is one of the few positive feedback mechanisms within the body. And the external break or shut off of the feedback cycle is delivery of the baby and the placenta. So basically what will happen that so whenever the baby is ready to come out of the uterus, so what will happen? The cervix will, this is the cervix of the, you imagine, this is the cervix of the uterus, it is stretched. Okay, so from that region, the impulse will generate and reach the hypothalamus. Hypothalamus, it releases oxytocin hormones. The oxytocin hormones are stored in the pituitary gland, posterior pituitary gland. So what will pituitary gland do? It will release the hormones, oxytocin hormones. So whenever the oxytocin hormones release the target area is uterus. So the smooth muscles, the muscle's name is myometrium. It will, which will do contraction. Contraction. It will do contraction. Then the baby and the placenta will come out easily. So this is the process of delivery. So this is natural delivery. So basically, uh, some female doesn't able to release much amount of oxytocin, or their muscles are stiffed, or they live sedentary life. So what will happen? The muscles are unable to contract. At that condition, the physician or gynec doctor will see and give the oxytocin injections, hormonal injection to contract of the uterus from outside. Even though given if contraction is not happen, they will do surgery. Okay, this is the process. Okay, it has been discovered that the placenta itself secretes oxytocin at the end of the gestation, and in an amount of higher than that from the posterior pituitary gland. Research is continuing to determine the exact mechanism and precious role of the placenta in labor. So basically, here one more uh, research is came that placenta, the covering of the baby, is known as placenta. So the placenta also release oxytocin when the gestation period happen. So large stage of gestation period means 9th month. So what will happen? Even though pituitary gland is releasing oxytocin, but placenta also releases the oxytocin, which will help to contract the smooth muscles myometrium very easily. So this is very good thing for us. And even though there are multiple uh, researchers going, so what is the exact relation of placenta in that condition? Okay, maybe in the future we will know about that. When a baby is breastfed, the sucking of the baby stimulates sensory impulse from the mother's nipple to the hypothalamus. Nerve impulse from the hypothalamus to the posterior pituitary cause the release of oxytocin, which stimulates contraction of the smooth muscle cells around the mammary ducts. This release of milk is sometimes called the milk letdown, reflects the hormones of the posterior pituitary are summarized. Okay, so basically, so if baby is born, no, baby is born. So what he required? He required milk. He drinks milk. So whenever the baby touches the nipple of the mother, so it will sensory stimulate the sensory impulse from the nipple to the hypothalamus. Hypothalamus release, or it will advise to pituitary gland, please release oxytocin hormone. So oxytocin hormone release, what will happen? The mammary ducts which are present around they will release milk. Okay, so what is the great nature of the great nature, how the nature works? So if the requirement of the babies is completing with the help of them only. So if he touches the nipple only, then only the milk produce. Okay. So because of his necessary thing, milk is his necessary thing. So this is the nature of the God. Okay. This is the power of the God. So we have to understood about those things. Both ADH and oxytocin are peptide hormones with similar structure, having 9 amino acids, and both have been found to influence aspects of behavior such as nurturing and trustfulness. Certain brain cells have receptors for reciprocity, and they seem to be involved in creating the bond that sustain family life. Trust is a part of many social encounters such as friendships, school, sports, and games, and buying and selling, as well as family life. These two small hormones seem to have some influence on us mentally as well as physically. So basically, so it isn't or scientifically, but how it influence our life, ADH and oxytocin. So if you found Basically, so what is the relation of ADH and oxytocin in our life? So basically, whatever the trust or any nourishment with the trust we are getting, bonding with other person, so because of this harmony only. Okay, so trust is necessary for every part of life. So friendship, school, sports, and games. Okay, so we have, if even though we are selling or buying anything, we need trust. So these are the important things we have to understood. Okay, so posterior pituitary gland will release ADH hormones and oxytocin hormones. So whenever the patient complains, sir, I have large amount of urine, I am I am urinating much more than normal. So you have to think about ADH hormone. Even ADH hormone is not working. With any problem, the posterior pituitary gland. Okay, ADH hormone, also known as vasopressin, increase water reabsorption by the kidney tubules. Water returns to the blood. Decreased sweating causes vasoconstriction. So these are the functions. A regulation of secretion. What is do? If you take alcohol, what will happen? ADH decrease. Oxytocin. Oxytocin, it will contract the uterus and release of milk. Okay, how will happen? Because of nerve impulse. Okay, so these are the things we studied. Okay, tomorrow we will discuss about anterior pituitary gland. If any doubt, you can ask.